My name is Mike Crocker. I'm the founder of the Sexuality, Attachment, and Trauma Project, which is a program that specializes in treating out of control sexual behavior with individuals, couples. We do group work. We do a lot of training, and we do a lot of speaking and presenting. That's me in a nutshell.
I am Sean Pecknick. I am the director of the program at the Sexuality, Attachment, and Trauma Project. We'll also maybe refer to it as the SAT project. I handle intake calls with people that are interested in getting treatment with us. I am a therapist as well, and I come from a theater background, so I think a lot about how story and storytelling impacts our lives.
I'm Ari Lewis. I'm one of the therapists at the SAT project. I specialize in working with out of control sexual behavior, and I also work a lot with folks who are consensually non-monogamous.
So two of the three of you mentioned specifically out of control sexual behavior. So it raises a question for me and for the listeners to think about labels, right? Labels around sexual behavior and what's seen as problematic. And maybe the most common label out there is sex addiction. I'm just sort of curious what your thoughts are about that and why you chose the words you did.
Yeah, it's so interesting. In these last few years, so many more people are seeking out therapy and self-identifying as sex addicts. It's certainly in the pop culture. We prefer to use out of control sexual behavior for a couple of reasons at our program. And when we think about sex addiction, one of the things that comes to mind for me is that the solution to addiction is sobriety. You know, if we're looking at it from that model, from that framework. And on some level, we're talking about semantics and word choices, but on some level, we're talking about the way we approach the work. And we just don't believe that you should be sober from your sexuality. So we work with a compulsivity model. We believe that people that struggle with these symptoms, which is that some aspect of their sexuality has gotten out of control in some way.
I just wanted to add to that when we think of compulsivity, which is kind of the way that people would think about a number of behaviors, not just sex, but shopping and spending and food and so on. The model of compulsivity is about warding off a negative emotion. What happens is that when these things become out of control, it's because they start taking on other functions rather than just sexual relief and sexual satisfaction. Sexual behavior and other behaviors start to be used as a way to not feel sadness, not feel anger, not feel fear, and not feel grief, not experience grief. And so it's a very effective compulsion that is a solution that later on becomes a problem.
I think everyone's definition of what is healthy for their own sexuality has to be self-defined. And that's why we were cautious of the labels, because I think people get an idea of my sexuality needs to look like someone else's or some cultural idea. And for one person, their behavior might feel compulsive to them, and for another, that might feel quite normal. But, you know, we come from a very sex positive place. We come from a harm reduction model. It's not about eradicating things, but it's about how do we create a sense of agency in your life so that you get to choose your version of sexuality rather than have it chosen for you.
When you say self-defined, right? That's like the people must come in thinking I have a problem because my family or my church or my community said this is a problem.
Yeah, and
Right.
one more thing that we talk a lot about is, so you call someone a sex addict or someone adopts that label. And of course, like Sean mentioned, it's semantic, perhaps, but it can also carry with it a foreclosure of a lot of possibilities of agency, of compassion, of curiosity, and it can also further exacerbate the problem, adding to the shame that person feels.
I think one thing that Ari's saying that I want to highlight because it's so important is that so some people come in to our program and they identify as sex addicts, and we don't tell them not to.
Yeah.
We just find out how they came up with it, what is their definition, what is their way of understanding it. And so we don't put the label on them. They come in and we find out how they're thinking about what it is that brought them into therapy, and what their definition is. We don't put the label on them. But then part of our work is very psychoeducational to help them understand what they're doing and why they may be doing it. And it's very much a collaboration between the person that comes in and me as therapist or Ari or Sean or whoever it might be. And then that collaboration starts to try to understand what exactly is this behavior all about, and which parts do we want to try to help you to embrace, and which parts do you want to start to diminish and dissipate.
We work with people that use all sorts of methods to treat these issues. And we have lots of folks in 12-step. We have lots of folks that use the language of addiction, and they find that it's very helpful for them. And we meet them there. One of our taglines for the program is, we treat people, not problems.
Yeah.
Right? We're not looking to sort of think of you as this set of diagnoses or this set of labels. We're thinking of you as a human being that's in context of your life and wants to find intimacy and love and connection and play and fun and pleasure. And we try to bring all of that out in a person's life.
Well,